Hello and welcome to another episode of Learn Anatomy by Drawing. I'm Dr. Mark Braidwood, and in this video we're going to draw the carpal bones, or the bones of the wrist. They can be a little bit complex and a little bit intimidating to learn, so I'm going to show you not only an easier way to draw them, but also to kind of make sense and navigate your way around them. Okay, let's have some fun drawing some anatomy. So, as always, we start with our rows to show us where we are. So this is a little bit challenging, this view, because this is an anterior view or a palmar view. We're looking at the palm, and that makes this side here the lateral because of the anatomy position. The anatomy position is actually sort of palm down, so then this makes this the inferior, the fingertips the inferior or the distal, and then that is the superior, and then this will be the medial. So that orients us. Okay, so let's have a look at the reference. So the first thing to note, there's 8 of them, and they're in 2 rows. So there's the first row, forms that smile, and then the second row there, 4 to each. The fourth one, this one here, is quite small. And we're going to pay attention to 3 of the bones to orient you. This one here is the scaphoid, and it's the clinically most relevant. This is the capitate, and it sort of dominates in the middle. And then this little guy here, the pisiform. So we'll get to labeling them, but that's what we're going to draw. So the palm, when you look at your palm, here's the carpal bones sort of occupy about there. Okay. So let's start by drawing a box that will help us pop these in. Okay, like this, just draw a box like this, and then a bit of a smile. I'm drawing a little bit darker as ever, so you can see, but you should draw this lightly. And then about there, we've got the extent of the carpal bones. Now, what I want to draw here is roughly this kind of shape here, which shows us the division between the two. So about here, because we're on the lateral, the thumb is here, we're just going to do this, and then it comes, start that again, comes down like this, and then we come up like that. All right. And about here, if we just put the thumb in, just to show you, because I think that's another useful way. This here is the thumb, and so you've got 2 bones that sort of continue onto the thumb, and that's another really useful way to find your bearings in the carpal bones. Okay, I'm switching to pen, but by all means stay on pencil if you like. So this is the largest of the carpal bones, and it just sort of comes in like this. Now, we're not trying to get these shapes exactly right. I think you're better off at, certainly in the beginning stages of anatomy, learning their positions rather than their exact shapes. Because once you know their positions, you can figure out what they are. Okay, so we've got that shape there. So these aren't necessarily going to exactly look like the reference or fit together as neatly. You can go back and do it properly if you like. But this is a way to sort of, if you know you've got 4 and 4, this helps you sort of put them all together and remember them. So I'm going to draw that circular pisiform there like that. First up, excuse me, and then behind. That comes here. Okay, so we've just drawn, that's the pisiform there, and then that bone there is behind it. And so that's one really good way you can tell that you're looking at the palmar surface. If you can see that bone, then you're looking at the palm, because when you roll it over, it's a bit hidden. Okay, so it's one of the first things you can do to orient yourself. Okay, so that's the 4 there. Then I mentioned this big guy in the middle here. So I mentioned this big guy in the middle here. That's let's draw that in, so it sort of takes up a dominating position there, like that. Okay. So continuing on with those two bones behind the thumb. We've got one here like this, and one here like this. And lastly, this large one here. Okay, so let's pop that in. And there is a bony protuberance here, which we will label in a moment, but I just want to sort of pop that in into the diagram, because you might get asked on your exam about that. All right, so that's pretty much, that's it. I mean, you can see once you sort of break it down into 2 rows of 4 and you look for your landmarks, they're pretty easy to put in. So now let's label them. I'll just clean it up a bit so it's easier. So most importantly is this guy here, and that is the scaphoid. It is Greek for boat-shaped. So you're looking for that sort of, boat jelly bean. Now, it's the most common fracture of the wrist in that bone there. And it happens with what's so-called fall on an outstretched hand, where you've got dorsiflexion there and you fall like that. And the way to test for it is you push into this part of the hand here. This is called the anatomical snuff box. Snuff was a tobacco product that people would put there, and then they would raise it to the nose and sniff it in, so it's called the anatomical snuff box. If you push in there and the patient jumps off the table after a fall, there's a chance they've got a scaphoid fracture. It's really important not to miss it. So obviously that justifies an x-ray, but even on x-ray, a significant proportion of these are missed. And so if there is a suspicion with pain in the snuff box, they go into a thumb spiker cast for a week and get re-x-rayed, or perhaps a CT, because it's just too big a risk. Now, one of the issues here is that the scaphoid has what's called a retrograde blood supply. So I'm just going to switch to red here. So the blood supply sort of comes down like this, and then it's almost like it's recognized that it's missed it, so it scoots back like this and supplies it that way. Now, why that's significant is because the most common site to be fractured is across the waist. And what can happen is if you compromise that retrograde blood supply, then this part of the scaphoid can die. And you get what's called avascular necrosis. So a really important bone, likely to be in your exam, if depending on what level that you're examined. So good to know. Good. That's one of the reasons I put this out, and it's an easily recognisable shape. It's sort of at the base of the thumb there. Now the other one I mentioned is the pisiform bone. Now, really easy to recognise and useful for figuring out whether you are looking at the palmar or the dorsal view. This is, I think, means P-shaped. Continuing with food names. If you've watched my hip video, we talk about that. Okay, and then the other big landmark that I wanted you to note was this one here. And this is partly just helps you remember. It's called capitate, which really probably just is referring to, capit like head. But I like to think of this as the captain because it's right in the middle and it's big. And so you've got these 3 landmarks. The other reason it's useful to think of it as the captain, because captains have first mates, captains have mates, and right here is the hamate. So the captain has a mate. Okay, has a hamate bone. This structure here is probably worth knowing. It's called the hook of hamate. It's quite obvious. It's an attachment for muscles, but it also forms the medial border of the carpal tunnel. Okay, so next to the scaphoid here, this is the lunate. Now, tricky one, it doesn't look You know, lunate, you'd think it's going to be crescent shaped. And it actually is, but it is crescent shaped sort of anterior posterior direction. Now I've put up on social media some sketches of these, some prep sketches that I did, and one of them is a lateral view of that from here, and you can see that it's a lunate shape, so you can, it's a crescent shape, so you can check that out. This guy here is the triquetrum. And then these two here have a very similar name, so I'll show you how to differentiate those. The base of the thumb one is called the trapezium. And the way I remember that is M, thumb has an M in it, and so does trapezium. And this is the trapezoid. All right, so there you go. That's the carpal bones. So try drawing that from your memory. Get that idea of those two rows in there, that one and that one, and look for these useful landmarks: pisiform, capitate, and scaphoid there. Now they look similar to this from a dorsal view. We're not going to draw the dorsal view, but one thing to note is that capitate's can look a little different on some references. But if you know this well, you can just kind of flip it. And some references will have this the other way around, as though you're looking up at the palm. So you might want to practice drawing it, essentially drawing this upside down. But again, these bones help you orient yourself. All right, hope you enjoyed that. Go ahead and draw, and we'll see you in another video.